Professor Gabor Forrai, working here in Budapest, former president of EUSOBI, the European Society of Breast Imaging. I have been leading different departments, state hospital, university hospital, and private hospitals, radiology, and within this breast imaging, I'm doing mammography for 35 years, digital mammography for 25 years, and breast MRI for 28 years. And I'm an international lecturer. I've got the new Barco monitor for testing for some weeks, and I'm working with it in parallel with the previous model of Barco, the Mammotomo. So I'm comparing all the cases. So the most important features of this new Barco Coronis OneLook display are the size, the fantastic big size, the brightness and the contrast, and we see a lot of details on them. The fact that I don't need to split, scroll and magnify through the images and different details, but I see them in total on one image, it means that it shortens the workflow. All the diagnostic procedure will be shorter, and we can find earlier the lesions because we don't need to wait for the magnified images, but we see it in the meantime we display it. I think this huge monitor, if you are sitting at an appropriate distance, it's already occupying your human viewing angle, so you can concentrate on the diagnostics probably a little bit better because you don't see anything else on your view than the monitor itself. Previously, with smaller displays, on 1 pixel of the display there were some pixels of the detectors compressed within 1 pixel of the display. And nowadays, with the new monitor, that's really great that we don't need to split the image or magnify different images because we see exactly the same what the detector of the mammograph sees from the patient. We are very happy with the new monitor because with this brightness we can use a little bit more of backlight in the room, which is appropriate also for ultrasound imaging. I have to add that there is this backlight function of this new monitor, which allows us to see the same brightness on the monitor and on the wall which is surrounding. So if you happen to see a little piece of the wall which is behind the monitor, then your eye doesn't need to adapt. We radiologists, we love contrast, so we are looking for more and more contrast at our examinations, which depends also on the mammography system itself, but also on the display. And even from the same mammography system, if you work with a higher contrast, higher brightness monitor, I think that younger colleagues who are not so experienced would find the lesions a little bit more easy than with a low contrast grayish image. So that's why I would recommend to all breast radiologists and young colleagues to get used to the high contrast. We like the presence of the patient, and we sometimes explain them on the image what is happening, what will happen, why is our decision so, what is the preferred therapeutic surgical method. So it's good to show it to the patients because some of them are very bright to understand, and also they are looking after and reading after their cases. So I got some feedbacks from my patients that they were very happy to see so many and so big monitors in the room.